Now we'll talk about the next artery of the human body, and this one is what is known as the inferior ulnar collateral artery. So for me, when I was in junior class of medical school, how I used to actually understand these arteries is I usually used to abbreviate them. Like this inferior ulnar collateral artery, now trying to just grab this name as a newbie is usually a problem, and of course you have hundreds of other arteries to grab. So I just say this one is IUCA. So I'll just be cramming it the whole day. Okay, so inferior ulnar collateral artery, let's first of all identify it on this picture. And you know that what this is the hand, okay, this is the elbow joint. So it's an artery that is found around the elbow joint. So I learned about its anatomy, because if you are going to do any surgeries around the elbow joint, you should know that this artery exists there. So this is what the inferior ulnar collateral artery. Let's go to the next picture and also identify. Okay, this is the elbow joint. Look for the what? The inferior ulnar collateral artery. So this artery, we say that it's a branch of the brachial artery in the arm, and let's because say that the big artery that is coming from is the brachial artery. The brachial artery is given so many branches, and one of the branches is the inferior ulnar collateral artery. So it arises just above the elbow, and it runs medially and anterior to the medial epicondyle, and it contributes to the periarticular, arterial, and anastomosis. Like these various connections here is what is known as the anastomosis. So origin arises from the brachial artery, usually about 5 centimeters above the elbow joint. So it's actually one of the two collateral branches of the brachial artery. So it runs medially towards the elbow, and it passes anterior to the medial epicondyle of the humerus, descends between the brachialis and the pronator teres muscle. It terminates by joining the anterior ulnar. Okay, you can see the anterior ulnar collateral artery, so they now get to join. So connections, it contributes to the arterial anastomosis around the elbow. So together they supply structures around the elbow. Beautiful, right? They maintain the blood supply. So anastomosis with the anterior ulnar collateral artery and other collateral branches. Just that, so that they can maintain blood supply around the elbow. The elbow joint is a very important joint, because it's a joint that you use all your life. Do you understand? All your life. We have some other joints in the body that you rarely use, but the elbow joints, the shoulder joints, the knee joints, the hip joints, they are joints that you use all your life. So supply actually supplies the medial aspect of the elbow joints, supplies the muscles that are found around there. There's the brachialis, the pronator teres, and the rest of them, and also contributes to the rich blood supply that is found around the elbow. So clinical significance, we learn about the anatomy of this inferior ulnar collateral artery because you want to know about the collateral circulation around the elbow. You want to know about the surgical relevance. You want to know about how this artery can be involved in imaging in case maybe there's an issue around the elbow. Most of the times, road traffic accidents or contact injuries, like in sports, all those crickets, all those things. So also trauma. Okay, want to learn about it so that you can access it. So that was what we got for the inferior ulnar collateral artery.